So let's look a little closer at the structure of the pelvis. So the pelvis is made up of four bones. This is the sacrum, which is this beautiful wedge-shaped bone at the base of the spine. This is the coccyx, and then either side we have the two hip bones. So the four bones come together to create the pelvis. The sacrum is one fused bone in adulthood, but interestingly, this can be made up of 4 to 7 different vertebrae, so there's a lot of human variation there. And with the coccyx, while most people have 4 vertebrae, some people have 3 and some people have 5. So let's now look a little closer at the hip bone itself. It was originally 3 parts that fuse in our teenage years. So the first part is this ilium, which is this beautiful, big, flat, almost like an ear, which is a wonderful connection point for lots of muscles and ligaments. And then this region here is the ischium, which is the sitting bone or the sits bone. There's lots of different names for that. And then when we come back to the front, we have the pubis. So 2 pubi join together to create the pubic bone, and there will be a little wedge of fibrocartilaginous tissue here in between those 2 bones. And what's important to note also, we'll go into this in more detail later in the course, but this region here between the sacrum and the ilium is the sacroiliac joint. And there's a little tiny bit of movement available here. So a little bit of movement here and a little bit of movement here creates a very stable structure that is able to respond to the demands that we put on it. Let's come back to the hip bone for a moment. We'll zoom in slightly. If I remove the femur, we come across this really interesting, almost circular area. This is the socket or the acetabulum, the hip socket. So this is the point where the 3 separate bones, the ilium, the pubis, and the ischium connect and fuse to create the hip socket, the acetabulum. So really, really interesting. I'll put the femur back in. And then if we look below here, this region underneath the pelvis is essentially the pelvic floor. And it's important to note that there's no consensus regarding the actual description of what the pelvic floor includes. So you'll find multiple kind of quite varying definitions of this. But there are essentially layers of muscles here. And one of the deepest layer involves 2 muscles called the pubococcygeus and the iliococcygeus, and they are often termed together and called the levator ani. And you can think of this as the pelvic diaphragm that helps to hold in all the organs that lie in the pelvis. And then slightly more superficial to this are the puborectalis, and this helps to constrict the anus, the vagina in females, and also the urethra. So different layers here. And the muscles of external rotation of the hip that we explored earlier, particularly the piriformis and the obturator internus, also lie in this region. So they will affect the health of the pelvic floor in some way.